Hello, and welcome to another segment of Durham Celebrates Recovery. We are focused today on mental health, and we want people to understand how COVID-19 has affected people who are providing these services. And SAMHSA says that in any given year, 25% of the population will experience a mental health problem. But I think with COVID-19, that figure is going to be much higher in 2020. So it'll be interesting to hear how people are adapting to this, how they're changing to this. I should also mention our sponsors for this event is Alliance Health and Addiction Professionals of North Carolina. Without their support, none of this would be possible. I also want to say that these segments will be posted to our website every Friday, which means the first one will drop tomorrow on our website, recoverycommunityofdurham.org. And every Friday, there'll be a new segment. I'd also like you to check out nationalrecoverymonth.org to see recovery events throughout the country. And the last thing I want to say is, if people have watched the first two segments, they may start asking, why is this guy wearing a purple shirt every time he does this? And the secret is, it's because purple is the primary color for National Recovery Month. So wear something purple, a shirt, blouse, purple pants. Wow, that'd be something. But we'll know that you're actually celebrating recovery. So please try to do that. So let me first introduce our participants. We'll start with Larry.
Hi, I'm Larry Klubine. I'm a licensed clinical social worker and a licensed clinical addiction specialist. I work for Carolina Outreach on a community support team, which means I am part of a team of 4, and we provide services in the community. Before COVID-19, about 80% of our services were expected to be in the community, in folks' houses. We help stabilize people, often who come out of the hospital, and help them get their life back on track. So I'm glad to be here. Thanks for inviting me.
Kim.
Hi, I'm Kim Jansen. I'm the director of RI International's Wellness City program. So we are a peer-run recovery education center. All our staff are peers, so we're all in recovery ourselves, and we use our own stories to inspire others. Prior to COVID, we had a wellness center, and people would come in and take wellness and recovery classes and also get one-on-one support from the peer staff. And we have pivoted to doing Zoom classes and phone-in classes, and then the phone-in peer support. And we are funded by Alliance Health, and so we were open to anyone over 18 that is interested in getting some support and having more wellness in their lives.
Thank you, Kim. Ramona? You must be muted. You must be muted. We'll come back to you. We'll come back to you. Joy?
Hi, I'm Joy Brunson in Subuga, and I also work for RI International. I oversee several crisis facilities and community-based programs. Prior to COVID, we provided crisis services, and during COVID, and now we still provide crisis services. We believe that a crisis doesn't have a schedule, and that we are meant to be here whenever someone needs assistance. And so we are also based in the recovery model, and we also infuse the clinical and the medical into what we do as well. Our services do look a little different in that we have to be very careful about screening and temperature checks and social distancing while assisting individuals who are in crisis. But we are here and able to serve individuals in Durham County and also in Cumberland County.
Thank you, Joey. Ramona? Your sound?
So Bob, I'll do the introduction for Ramona. Ramona and I both work for Alliance Health, and Ramona Branch is our individual and family community engagement specialist for Durham County. And we work together on the community health and well-being team at Alliance Health. My role is as the Director of Community Education and Outreach. Alliance Health is one of 7 local management entities and managed care organizations in North Carolina, and we are providing the oversight of services for both Durham, Wake, Johnston, and Cumberland counties. And so we are pleased to be here today and want to participate in any conversation about recovery and the challenges that we are all facing right now with COVID.
Thank you. Wonderful. Ramona, you're still not with us exactly, right?
I'm talking, but
There you are. There you are.
I mean, I don't know what happened. This is a new computer, but I didn't have any problems last night. So thank you, James, for introducing myself.
My pleasure.
I apologize for the technical difficulties, but like James said, I am a member engagement specialist with Alliance Health. I'm also a certified peer support specialist and a certified alcohol and drug counselor. So I'm glad to be here today, and I'm glad that you all can hear me.
Wonderful, wonderful. So I'm wondering, as providers, how have you been able to engage your consumers, and what has changed as far as how you engage your consumers? Let's start with Kim.
Well, so prior to the pandemic, people would just walk in and could immediately get registered and come to any of our classes. So we would, talk to local providers, go out to different events. There was a lot of word of mouth where people would find out about us. And so obviously that's not an option right now. We used to have classes with 20 or 25 people in one room for a class, and that wouldn't be safe right now. So we had all of our people who were engaged prior to us shutting down the in-person services have transitioned over to either coming into the remote classes or just getting the phone support if they're not comfortable with the technology or don't have access to the technology for the remote classes. But then we found that a lot of people who didn't come before for a variety of reasons. Some had transportation issues or childcare issues or elder care issues. Some work and they couldn't get off time to drive across town or take the bus for an hour each way in Durham to try to get to a class. And so now they can just jump on Zoom and come to class. And so we've had a bunch of new intakes of people who this medium works really well for them, or people who, like you said, Bob, are struggling right now. It's an especially challenging time and need some extra support, like pretty much all of us right now. So we've seen the regular people and a whole new influx of people.
Very good, interesting. So you're actually reaching about the same number of people, but just different people than you're normally seeing walk in.
Yep.
Okay. Larry, how has your treatment services changed during COVID-19?
Well, as I mentioned earlier, previously about 80% of the services we provided were in the community. And now, particularly in the first couple months, we saw no one in person. And so everything moved to telebehavioral health, a platform like Zoom or Skype, or by phone. That left some people out because there are some of our clients, I think right now about 3 or 4 of the 18 on our team's caseload do not have a phone. And that meant that they had to borrow a phone and call us, or call only when they were somewhere where they had wireless and could use that. So it meant a big change. It meant often we would in the past go with a client to DSS to apply for food stamps, or go with them to Social Security to apply for a Social Security card or disability. And those days of accompanying people are past. They're not safe, and most of those places now are closed. So now we do a lot of telebehavioral health. Instead of seeing someone for a couple hours once a week, I may do 3 or 4 check-ins of 15 to 30 minutes each by phone. And then telebehavioral health, which is like this meeting, can go on. The other thing that's affected sometimes is, of course, you have to have a phone, you have to have an internet connection, you need privacy, so when I would pick you up before, and we might go to the park or the library to a study room where we had privacy. Now you may live in a group home or a boarding house without privacy. So part of even meeting by this is making sure that our clients are in a place where they can speak to you and feel like you're in a confidential atmosphere. And sometimes that just means going outside. I see a few people now in person outside, usually on a porch, or I keep a couple lawn chairs in my vehicle, and sat under a tree this morning and saw someone. Our psychiatrist visits have all moved online. We use a platform called DoxyMe. So people see a doctor online now. They don't see them face to face. And while that's made it easier because of things that Kim mentioned about transportation and difficulty, it's also it's caused some adjustments to forming connections with someone that you're not in the same room with. So I think that there's been a few opportunities. We'll talk more about them later, and some challenges, and we're just soldiering on.
Hey, very good. And Joy, I thought what you said before, I really hadn't even thought about that. You are basically doing sort of an inpatient program, a detox program, and you have to worry about all of the protocols for protection for your staff and yourself. How is that being managed, or how do you manage that?
Yeah, so we have 2 units at the crisis facility here, and we do mental health stabilization and non-hospital medical detox, and just an overall access point for the community. And so when all of this kind of started, we realized we were not prepared. We were not epidemiologists. We did not know, how to handle this. And so as a company, we kind of instituted this whole war room type mantra where we met every day. And every day we were learning and growing and figuring out what we needed to do in order to stay open and to make sure that we were serving the community. RI really values being there when someone has a crisis. And so we had 2 people dedicated to just securing PPE because early on, PPE was very hard to find. We started adjusting procedures, writing protocols, policies around COVID screenings, getting equipment that was even thermometers that were like non-touch. And so it really took every day 2 months of working together with our whole corporation to make sure that we had everything that we needed. Everyone was trained, everyone was on board in order to stay open. For anyone who's been to the Crisis Center recently, you know that we did a full-scale renovation on both units and took out a lot of those bedrooms and those spaces that required people to be separated. So prior to our renovation, all of our staff had their own independent offices. Every guest had an independent room. And so that really made it hard to do engagement and connection and observation and all of that. And so we did this full-scale renovation and opened up everything. And now everyone's kind of together. That was the whole purpose. Engaged, close, connected, which is the exact opposite of what you would want for a pandemic. And so now we're trying to figure out how to separate everybody out again, to make sure that everyone's, social distance. And so we had to move what we call a staff island, kind of separate people so that they're not close together, push bedrooms, the beds far apart, and it really became an effort to kind of undo what we really tried hard to create a very engaging environment. And so it took, I would say, a good 2 months to really figure out all of our protocols and to really get staff on board, because we've been pushing customer service and engagement and peer support and connection and sitting with people. And so to then ask for the opposite of that, like you need to spread out, we need to be separated, was really hard for our staff to do. But we're coming along, and we've been able to stay open throughout the entire pandemic so far.
Wonderful. I keep hearing that on the news that there's still shortages of PPE, and I'm wondering if that's still an issue in terms of those supplies, and whether they have become much more expensive now for some reason.
Mm-hmm. They are very, very expensive. And yes, they are still very, very hard to find. And expensive just because they cost more than what they usually did, but also expensive because this is not something that we thought we would be spending dollars on. And so in every sense of the word, it's become more of a kind of a financial issue. But we've been able so far to secure masks and shields and gloves and gowns, not only for ourselves, but we also offer PPE to our guests that come in as well, so that they're in masks when they're here. So far so good, but it definitely takes a lot of effort to keep a place like this stocked with PPE.
Thank you. Ramona, what are you seeing?
So part of my role with Alliance has been, going out into the community and doing a lot of outreach that way. And since COVID has hit, we have not been able to go out in the community. We can't go to the members' houses because, it's a risk. And so what we've been doing is pretty much talking to the members on the phone. I actually work in one of the projects that I'm working on right now is through the Transition to Community Living Initiative, where we have been reaching out to these individuals, over the phone every 2 weeks, just to make sure that they are having all the needs that they need met. And, if they feel like this week, oh yeah, I'm not doing really great and I might need an extra session with my therapist, we're just doing that every week. It's called like a COVID-19 check-in. So that's worked out really well, and we've been able to address any, needs that they need for that particular project. And then also I work on another project, and we have been, utilizing the phone. Sometimes I feel like I work in a call center now because it's like we have to do everything by phone, and our contact, face-to-face contact, is very limited. So most of the time our outreach efforts consist of going into the community and resource fairs. Usually the end of August and September pretty much will ramp up, and we're able to get out education materials to members in the community that might need it, that are not able or aware to access services or how to do that. So one of my other teammates and I for Durham County have been brainstorming about ways to get back into the community and not be face-to-face like we used to until it's, appropriate for us to do so. So we're going to put up, we're getting together like packets to go out into demographic areas of people that we need to reach. So I think that's really beneficial. You know, we've really had to think outside of the box during this time without, you know, we've had to, you know, follow the recommendations from North Carolina Department of Health and Human Services about what we can and can't do. So, you know, thinking outside of the box and being creative, so we can reach that population that might need the extra help right now. Because I think, like, from a personal standpoint, I think the quarantine has it has exacerbated people with SPMI and substance abuse. And, you know, I think that this is a critical moment for us to really pay extra care to the community during this time, because, you know, it's been bad. It's been bad on everyone. And, you know, I feel like that our presence in the community is definitely needed. And just, you know, learning how to work around and find creative ways to reach the population during this time.
Yeah.
That's what we've been doing.
Okay, thanks. James, can you say a little bit about how Alliance Health is supporting the providers and helping them to engage consumers?
Yes, and we are doing everything that Ramona mentioned, and the additional initiatives that we're involved in is called Hope for North Carolina. Hope and the number 4 North Carolina. As a local management entity and managed care organization across the state, we have received FEMA grant dollars in order to reach out to individuals impacted by COVID. So the Department of Health and Human Services has established 2 mental health resources to help North Carolinians cope and build resiliency during the time of crisis. And one of that is having a helpline. And so we have our teams established to be able to manage the helpline. The phone number for the helpline is 1-855-587-3463. And it connects individuals to additional mental health and resiliency supports to help them be able to cope and build resiliency during this time of crisis. It's part of a crisis counseling program. Again, everything that we do is free, and it's part of an initiative to reach out and connect with individuals, because as Ramona mentioned, people are hurting. They've been traumatized, they have been impacted. We want to help them. In addition to that, we're also participating in Hope for Healers Helpline, Help for the number 4 and Healers Helpline. And that's a new initiative in partnership with the North Carolina Psychological Foundation to provide mental health and resiliency supports to mental health care providers, emergency medical providers, first responders, and other people that are on the front lines helping people and impacted by COVID. So those are a couple of programs that we've been involved in as part of a statewide initiative in order to provide the additional support. Another example of what Ramona was mentioning is a way in which we have reached out to the community is that instead of taking money that we would use for sponsorships of conferences where we normally would reach the community, we actually took that money and put it into buying children cloth masks. And we have bought thousands of those masks for each of our county, along with COVID coloring books that were put together by UNC Health. To reach individuals, and again, looking at what do people need now. And I think that's the message of recovery, is looking and asking people, what do you need now? And so we went to our key stakeholders at social services and Department of Public Health and public schools and asked them, what do people need now? And the children's cloth mask was their response. So we're looking at ways that we can make an impact now in a different way than we've done before. And similar, as was mentioned about the virtual services or virtual trainings, we're actually able to reach more individuals. So even like this training, even though it's kind of focused on Durham County, people from across North Carolina will be able to access these types of trainings, and we've seen an increase in the number of people attending.
Wonderful, wonderful. I was wondering if Alliance has seen any changes in the number of people calling and wanting to have services, and whether that system has changed at all in terms of how you're referring people.
Sure. I do not know the answer to that question. What I do know, similar to what Ken and Larry said, and along with Joy, is that the ways in which people are receiving services has changed. And we were exploring, and there was a certain amount of telehealth going on, but it was not at the level that we had now. And so there had to be an immediate response from the state in order to put in the codes to support people to be able to provide these type of billing. Because prior to COVID, it was all based on face-to-face services. That's the way the contact had to be made. And so now this has really opened up a new ways in which people can receive services, which supports recovery, which is people get to choose as to how do I want to receive my services, what format works best for me. And now we have more options for people, which is a silver lining to what has been a very difficult period for everyone.
Thank you. You know, as a retired clinician, I'm used to having when I was working, having a caseload, and I'm wondering if that's still the case. Do people still have caseloads, and is there any sense that people are falling through the cracks? Larry?
Well, as I mentioned earlier, I think the people that fall through the cracks may be the people who don't have technology. I was just listening to NPR, and students are falling through the cracks when they don't have a tablet, a computer, or Wi-Fi. And I think the same way with many of those who are most vulnerable in our community. When you're trying to get enough to eat, keeping a smartphone, and keeping it on is not a high priority. And if we're not careful, those are the folks that will fall through the cracks. There are also a small percentage of people, I think someone mentioned people with SPMI before, that's serious and persistent mental illness. And some of those folks, depending on their symptoms, have mistrust of technology. And by their very illness, technology is something that increases their symptoms, might increase your paranoia. And those folks also face some barriers to engagement through telebehavioral health. So I think we just have to be careful that we don't let that we protect the least of them, that we protect everyone, regardless of their ability or their comfort level. Now, I have clients that have a smartphone, but they can't navigate a Zoom meeting. It confuses them. So for those folks, we just have to keep on working at what works for them.
Very good. Yeah, well, it confuses me too. So Kim, how about you? Have you noticed any changes in your caseload, or how you're tracking what you consider to be a caseload?
So yeah, before, again, people would just come in for classes, and so we saw people, like some people came every day and all day long. We were like an extended family. And now, we're really having to be much more intentional. Staff are like navigating multiple spreadsheets, who talked to who came to class, who needs an outreach call. I'm really, ratcheting it down. Like maybe in the past, we could go as long as 60 days. If someone didn't come in for a class because they were doing their own thing, that was fine. And now I'm like, if we haven't talked to them in a week or two, we need to be finding out why, because it's just a dangerous time to be isolated. 60 days when you're out with your friends and having fun or going to work or doing whatever is really different than a week or two sitting home alone, ruminating in your thoughts. And so, yeah, there's a lot of like going back into the electronic health record and finding even like people who we discharged. I was just doing that today, pulling a list of names we discharged in like the 6 months prior and saying, do we need to reach out to any of these people? Even though they're not our responsibility, they're not open to us, still they might not be okay. Let's find out what's going on with them. Let's do a call. People who don't call, we're sending cards to, we're mailing the calendar or sending notes by mail even. And then sometimes they show up, phone numbers get disconnected, you can't reach them. So we're sending mail to people, just trying to make sure that people are okay, because it's just so easy when you're sitting home in your head for your mood to switch to a dark place. And, we're seeing a lot of people that are at a greater risk for suicide, a greater risk for going back to substance use and overdose. And so we're just really trying to connect with people and not have people fall through the cracks, like you said.
Right. That is the tagline for this year, by the way, celebrating connections. And even if you're only only connecting through Zoom, you can still connect with people, just not physically connect with them in the way that we did before. So what has, and it sounds like you've done a great job adapting to what is a historically unprecedented time in our history. What has surprised you the most about the technology, or what's working? What do you think is not working? What has really surprised you about all this?
One thing that
If I can go
you go
ahead.
first, Larry. No, Larry, you go.
I was just going to say, with some of our services, outpatient therapy, the no-show rate has drastically declined. It used to be as high as 30 to 40%, and now there are virtually no no-shows. So I think I've been surprised by the fact that, we love to complain about technology and bemoan the fact that we're missing out on the personal touch. But there are advantages. If you have unreliable transportation and you have small children in the home, getting up and going in an office, and Kim had mentioned it earlier too, and riding a bus, are barriers to treatment. And when you can meet with your clinician in your home, that barrier is removed. I also have 12-step meetings, and many of our clients are in recovery and going to AA, Alcoholics Anonymous, or Narcotics Anonymous, Crystal Meth Anonymous, and those meetings are almost all on Zoom now, and that means that you don't have to worry about transportation or babysitting or money for the bus. You can go to a meeting if you have a phone and a Wi-Fi connection. And if you move to Roxborough or some more remote place and you used to go to a meeting in Durham, you can still go to your home group, even though you've moved. I know someone, I have a friend who moved to rural Vermont and still goes to meetings in Durham. So there's that advantage. I'm, after this, later this evening, I'm participating in a workshop sponsored by University of North Carolina School of Social Work on dismantling systematic racism in social work. And that's going to be a Zoom meeting. And that's something that if it was at campus, I'd have to, I may not be able to make it. And I may get home and eat and say, I don't want to go fight traffic to get to Chapel Hill to go to this meeting. And so I'm going to participate in this. So it provides opportunities as well. And I see that in the future, that in many services, there may still be a virtual, at least option. There may still be some workshops, some therapy that takes place virtually, even hopefully in the next year or two as we find treatment, a cure, vaccine for this COVID-19. So there are some opportunities, and in bemoaning the isolation, and Kim is absolutely right. A lot of our clients lack natural supports. And one of our primary jobs as clinicians is working to build those natural supports, to help people make connections. And that's so much harder in a pandemic when you can't go to church in person, you can't go to an AA meeting, you can't go to Wellness City. So your opportunities of making friends, making connections with people who have your back are reduced. And sometimes the isolation can, as Kim mentioned, result in increased substance use, increased symptoms, increased depression, increased anxiety in some cases. And we respond on my team by much more, as I had mentioned earlier too, is much more frequent check-ins. And I think Kim had mentioned that as well, is sometimes just making people feel that it's always been important for people to feel that they're valued, that they're important. And I think it's important, even more important in this pandemic, for folks to know that we care about them, we care about their well-being, and that they're always welcome to reach out to us.
Very good, thank you. Kim, I saw you shaking your head. Do you have anything you want to add to that?
Yeah, well, like like Larry was saying, we at first were skeptical about the technology too, who would really come. You know, many of our regulars were in group homes with maybe no computer, no staff who really wanted to support them connecting. And some of them have come, you know, some of them who swore they didn't know how. If you get one-on-one on the phone with them and walk them through the Zoom app, now they're coming to class. One just joined this week. I mean, she's been coming to phone-in classes for 4 months, but just this week she turned on her video for the first time, and like the emails were flying. All the staff were so excited. So that was a surprise, and also the new people, that was a surprise. And you know, we're really focused, like Larry was saying earlier, and James, on choice, and the person being able to choose their comfort level, that their recovery journey is driven by their choices. And learning that people were choosing not to share their camera at first until they reached a certain comfort level. In the past, they probably would never have come into the center because walking into a class of 20 or 25 people would have been, you know, very uncomfortable for them. But instead, they could listen in, and then after a while get comfortable and share their camera. I mean, this one woman, she knew everybody. She came every day when we were open, and yet it's taken her 4 months to get comfortable turning on her camera, but she finally did it. So, but having that be their choice is really empowering. There's not a lot of things that a lot of our people that we work with feel empowered about. And it might be as simple as, do I turn on my camera or not? And that moment of empowerment. So that's been good to learn, educational for us.
Wonderful. Jory, what are you surprised about in terms of services?
So as I was listening to everyone talk, I don't know if anyone's read the A Paradise Built in Hell book, but it really looks at the natural disasters that we've had or certain situations, and looked at what positives came out of those and any changes or challenges that were overcome. And so that's one of the things that we've been trying to look at, is not only what we don't have or the changes that we've had to make, but also what are the things that that are positive that has come out of this. And so I think from our side, just being able to stay open and provide services, being resilient as staff, being able to do telehealth so fast, so quickly, when it's been a conversation for so long, and now all of a sudden we were able to do it. A lot of jobs and things like that we thought had to be face-to-face. Apparently they don't. And so I think there's just a lot of positives that we can look at that has come out of this, that we can focus on, and instead of all of the things that are negative and things we had to change and things we don't necessarily like. And so it just reminds me of that book. The author went back and looked through just a lot of disasters and situations we've had over the last 20 years, and then pulled out, what did we learn, what did we gain from each one. And those are the times when people come together. They are more connected, they feel more empowered, and they're able to make really great steps in the direction that they would like to go as well. So I think that's what I take from this pandemic, and all of the other situations that we've had on top of it. It's been a lot for everyone to go through, but we're really looking at how has this changed some of our lives for the better, or at least some parts of our lives for the better.
Wonderful, wonderful. Ramona, would you like to add something in terms of what surprised you?
Just that I agree with what Joy has said. I think, for everyone it's always been a conversation, and then boom, we went right into it. And I think it is really beneficial for a lot of people, because we really are able to reach more people with therapy. That, like, I know for a lot of the urban areas in, you know, some of the counties that they have maybe one provider. I mean, look now, they can really have almost a better choice of providers now, and then they can get the services that they need. And I think that, you know, that's a big positive coming out of that, because otherwise they could fall through the cracks and not, you know, be able to be helped. So I think that's a big plus with it. You know, technology is great. It's a blessing in some ways. So I'm glad that we have been able to utilize that aspect. You know, I still miss going out in the community, because I feel like, you know, that face-to-face and that interaction, and you can see someone and be in their presence. You know, I think that's really beneficial for a lot of people. But, you know, you can take what you can get at this day and time, right? So it's better than nothing. So I try to be positive about it.
Yeah. And it does seem that the adaptation to the technology has occurred at almost a light speed. I mean, I really didn't know much about Zoom until you know, a few months. I may have heard about it, but I never was interested in it really. But so, do you think this is changing like the way providers operate? I mean, do you think that is there a need, James, for Alliance to have a big office building somewhere, or is this going to affect the way businesses operate?
Sure. Alliance Health is very grateful to our provider network and to the agencies, and especially those represented today, RI International and Carolina Outreach, and for the providers who stepped up and got the services continuing and kept going despite some of the challenges and the uncertainty that we were facing. So we're just really grateful. Even though Alliance does not provide the direct services, we want to be the support behind the providers and the individuals that are doing that day-to-day work and that direct contact or indirect contacts with the people that we're serving. So we're just really grateful to the provider network and for their willingness to keep connected to the people that we're serving, and keeping connected to those families and listening to them and being part of that change. I think that has been one of the impacts, and it also happens with recovery and stages of change, is that there's been a huge amount of change within a short period of time, which really does draw on your resiliency, which is the ability to hit some serious bumps and to bounce back, or to keep going, or find a way to keep moving forward despite not knowing or having that uncertainty. So it really has been, you know, an opportunity for change, and that can be a very uncomfortable and difficult process. And I think the recovery message of connectedness and knowing that, and we've heard that throughout the pandemic, is that we're in this together, and that there's more of what we're sharing that is the same than what is different. I think part of that recovery is looking long-term as to, you know, whether we would need a large office space. So that's a change across the whole workforce. Yeah. Now people have found that they can work from home, and now that they have tried it, which was really uncomfortable for individuals at the first, now, it kind of feels okay. I kind of like this. And so people again have gotten choice about how they need to work and how they can do their work. And so that, again, preferences are coming out. And so I think this has been, has significantly changed all of us. And as you have mentioned, hopefully for the good. Definitely when you lose something, it definitely increases my gratitude, because I take a lot of things for granted.
Yeah, I think I'd be remiss if I didn't mention how supportive Alliance has been through this process. You know, in the beginning, during the shutdown, organizations like Carolina Outreach took a big hit. And as everyone in this room knows, or these rooms in this meeting knows, you don't go into behavioral health because you're going to get rich. you start providing behavioral health because you want to help people, and the break-even point is and the lose money point are not very far apart. And Alliance Health provided some stimulus funds to help organizations through that transition, and the other MCOs and Department of Health and Human Resources, they came out with these new codes, billing codes for telebehavioral health in a record time. I mean, I provide community support team, and it took 2 years to change the definition of community support, and in just a few weeks, maybe a month, they completely revamped the code so that it allowed services to continue through the pandemic, and that's remarkably fast for these organizations. I'm really happy that they stepped up, and really feel grateful that we have a great partner in Alliance. So thank you, James, and your colleagues, and Ramona.
So it sounds like people are saying. So it sounds like people are saying that the technology has become a very useful tool in the toolbox that increases engagement for certain types of people who may not have otherwise been engaged, or and it's something that's probably going to be here for some time. Is that a fair assessment? Do you think that, and as James was saying, the rate of change has been just phenomenal. And so I'm wondering, especially if you're directors of programs, how are you helping staff in terms of their own self-care, in terms of your own self-care? Because I think under these circumstances, it may be hard to know whether you're succeeding or not, whether you're meeting your goal for the day or not, or how things turn out. How are you supporting staff in this time? Kim?
Well, for me, the biggest thing is just acknowledging how people are feeling and that they're not alone in feeling that way. You know, my own vulnerability and being like, yeah, I'm struggling today, or today I'm just really fuzzy headed. And you know what? That's a symptom of trauma. And, you know, you might be having racing thoughts, or you having trouble sleeping. Like at any given time, we'll have multiple staff who can identify various things that they weren't experiencing before. And so just acknowledging that. Like my staff used to come into a work day and there'd be 25 to 40 people they interacted with during the day, and everyone was like upbeat and excited, and they'd be in a class of 20 people exchanging ideas, and you know, a lot of them are extroverts, so there's this huge energy infusion every day. And now they're sitting alone in their house with a screen. And I had to acknowledge to them, like, you know, if you guys saw the posting for this job the way it is today, none of you would have applied. you wouldn't want this job. But it was great, because when I was trying to acknowledge that sort of elephant in the room, they came back at me and were like, yeah, but once I get into it, you know, once I get on Zoom and there's, you know, 15 little boxes all talking, it's still there. The thing that brought me to this work, the thing that gives me joy, is still there. I just have to get over my preconception that I have to sit in front of a screen, but the people are still there. And so a lot of it is just sort of acknowledging where people are and still remembering why we're in this.
Thank you. Thank you. Joy, how are you doing, helping your staff, supporting your staff, or during this difficult time?
That is a great question. I think it changes on a day-by-day basis, and it has changed throughout the last 4 to 5 months, I would say. As a leader, I haven't had staff experiencing the same things that I'm experiencing, and the same things that individuals coming in for care are experiencing like all at the same time. I think this is a unique time where we're all struggling together, and so that lends itself to a different kind of support. In the beginning, there was a lot of, and still is a lot of fear, a lot of why can't we work from home? The other half of RI staff are at home. Why can't we be at home? Why are you at home and I'm not at home? And so there's a lot of conversations around risk and vulnerability and who can be on the front lines. And if I continue to come in, I'm also risking your health if I don't have to be there. And so really like having those types of conversations. And then it kind of moved to where we are now with individuals being very tired of being on the front lines, very tired of being in full PPE every day, and just being heightened at every single day. For us, sometimes it's hard to tell if someone is coming in crisis, and we're asking screening questions, whether they are detoxing, whether they have just walked all the way from somewhere to get here, and maybe that's why they're warm, or whether they have COVID symptoms. I mean, it's really hard sometimes to be able to tell. And so we want to not turn anyone away and be available and be safe at the same time. And so to be on the front lines and be kind of heightened and aware all of the time, and to have been doing this for months, it is very taxing on staff. And so I think that support today is very different than the support was early on. Right now, we're just trying to motivate people to keep going, motivate people to take your PTO. Even though you can't go anywhere, you still need to be off, and really get back to the roots of why we do what we do. Because my staff are really tired. And burned out from being on the front lines for so long.
Understood. Ramona, what are your favorite self-care techniques? What can you share?
So for me, it has been challenging during this time because, I am a peer, so that means that I do have a diagnosis of generalized anxiety disorder. And so for me, it's been really difficult sitting in front of a computer all day. I do have to take several breaks because like I said, I'm used to being in the community and going out. Like probably most of my time, probably 50% of my time was in the office and then 50% was outside. So this is really different for me to do everything on the computer. So what I have found that works for me is, taking frequent breaks. I have started journaling. I journal a lot of my feelings because I can do it right then and right there. When I can't go somewhere and get away to talk to somebody, I have my phone right here and I keep my journal on it. So I'm typing my feelings and I feel like that works a lot. I do feel that self-care is important, and I want to take a break. So I'm going to the beach this weekend. Self-care. So, and I like time away, even though we're not in an office, we still have a duty to work every day and do our job. So I feel like, time away from shutting down the laptop, not checking work emails, because I'm a bad person for that. Like if something comes through, I'm going to sit there and check it. And so I have to sit there and say to myself sometimes, it's 9:30 at night. I'm not going to do that right now, but then I sit here and think, well, what if it's something? What if? Because I said anxiety. So I end up doing it anyway. So, but shutting my computer down and walking away is, because I know when I'm at work, you know, I'm going to get up and I'm going to go here to print this off, or I'm going to go in another room to talk to somebody. So I kind of try to do that to put some kind of balance in there. And I do check on my team members a lot. My our team is really close knit, and you know, we're able to reach out to each other for support. In fact, yesterday I got a nice little card in the mail from one of my team members, and it just, you know, it was very thoughtful and it made me smile. So I think that's another good thing, like checking on your friends and your coworkers, because you know they're struggling just like you are, and you know, sprinkling kindness, it helps you. So
yeah. So Bob, we're supporting what Ramona is doing around self-care, and I'll give you an acronym. It's called SCOOP, SCOOP, and it's again being promoted by the North Carolina Department of Health and Human Services for the Hope for North Carolina program. And so this is exactly what we're talking about. So here's the SCOOP on managing stress. The S of SCOOP stands for stay connected to family and friends. Social connections build resiliency. C, compassion, exactly what Ramona's talking about, compassion for yourself and for others. Self-compassion decreases trauma, symptoms, and stress. Like Kim was talking about, how this can be very traumatic for individuals. SCO, the O stands for observe your use of substances. Early intervention can prevent problems. The second O is it's okay to ask for help. It's okay to say, I'm not doing well today. Struggle is normal. Asking for help is empowering. And then the P is physical activity to improve your mood. Exercise boosts mood and lowers anxiety. So we need to go outside or go to the beach or whatever we can do to get up and kind of move around, take frequent breaks. So that's the SCOOP on managing stress, and what I am working on myself and encourage my team and our community to some steps they can take for self-care.
Very good. I like that. I like
Yeah,
that.
and that's on the Health and Human Services website under Hope for North Carolina. It's out there. So we'll continue to promote that through social media because it's a constant reminder. It's easy to slip back into other types of not so helpful coping mechanisms.
Larry, you got any tips for us in terms of self-care? How do you take care of yourself?
Oh, I don't know anything that hasn't already been mentioned. I probably, we have 2 team meetings a week now instead of 1 for more frequent check-ins. I encourage my team to, when someone's feeling stressed, to take a personal day, take a day, and get outside. And some of these things that James mentioned with SCOPE, get outside and get some activity, get to moving, and eat a good meal, cook it yourself. You know, I think there's been a lot of increase in that. There has in my household. You know, we have time now where there was a time when I was in the community and grabbing a fast food lunch. And now that we're home now, we have an opportunity to make a fresh salad and eat healthier. And also, maybe not so healthy, make sourdough bread and some things I'd always wanted to try. So that's worked for us.
Yes, baking has become quite something that a lot of people are trying. But
Yes.
So I want to thank you all for participating. Thank you for being part of National Recovery Month. And keep up the good work. It sounds wonderful. Take care.